Hi, I'm Emma. The other members of our group are Nathan, Allison, and Grace. We are part of Chapter 60363 and Division 5137. Approximately 5 million citizens in the United States have Alzheimer's. That's 5 million mothers, fathers, sisters, and brothers suffering from this devastating disease that brings about memory loss, impaired cognition, and a host of other symptoms, and that number is projected to hit 14 million by the year 2050. Although it is the sixth leading cause of death in the United States, there is little known about the complex genetic processes behind Alzheimer's. Alzheimer's is a progressive disease. After being diagnosed, a person is expected to live 4 to 8 more years. Although there is no definitive cause for Alzheimer's, it is speculated to be caused by a buildup of amyloid plaques and tau tangles in the brain. An acetylcholine deficiency can also be linked to the deterioration of the brain and the development of Alzheimer's. The goal of Alzentric is to prevent tau tangles and slow the progression of memory loss in people who have a genetic predisposition for Alzheimer's. We decided to target the aspect of memory loss because, while there is currently no cure for Alzheimer's, our lozenge could give people who are suffering, or who have the potential to suffer from Alzheimer's, the chance to control their lives and hold on to their memories for possibly months longer than they would be able to without Alzentric. That's months longer they could have to spend with their loved ones, making the most of every minute they have left.
Tau proteins form microtubules that transport nutrients in the neuron. When these tau proteins become hyperphosphorylated, they lose functionality. Though normal microtubules are firm and straight, hyperphosphorylated tau cause the microtubules to tangle. The phosphorylation of tau is carried out by the enzyme casein kinase 2, or CK2, and occurs when CK2 adds the maximum number of phosphoryl groups that can attach to tau. Basically, Alzentric selectively counteracts CK2 to prevent hyperphosphorylation. Now, let's delve into the specifics of how our innovation works. Alzentric is mainly the combination of two active ingredients, nicotine and a pre-existing chemical called tetrabromobenzotriazole. I know, that's a big word, so we'll call it TBB. Nicotine serves two functions as an active ingredient. First, since there are nicotinic receptors on the neurons in which tau tangles will form, nicotine will take TBB to those neurons. Second, like Emma said, Alzheimer's symptoms largely stem from low concentrations of the neurotransmitter acetylcholine. Nicotine simulates the effects of acetylcholine since it also binds to nicotinic receptors. The second ingredient, TBB, is a competitive inhibitor of CK2. This means that TBB binds to the active site of the CK2 enzyme. Once nicotine binds to the nicotinic receptors, TBB will detach from it and pass through the cell membrane. Afterwards, TBB blocks tau from binding to CK2 so that phosphoryl groups cannot be added. Because it inhibits phosphorylation, TBB is the primary agent in preventing tau tangles. As for the active ingredients, we have sucrose, acesulfame potassium, tartrazine, magnesium stearate, lemon oil, and honey. Sucrose acts as a sweetener and a hardening agent in the lozenge structure. Acesulfame potassium is a sugar substitute with no calories. Tartrazine is a synthetic yellow food coloring. Magnesium stearate prevents the ingredients from sticking to each other while also maintaining a soft consistency within the lozenge. Lemon oil provides a sweet citrus flavor and also improves cognition and stress relief. And finally, honey just adds a little extra sweetness along with a soothing effect.
Alzentric can be found in both local pharmacies and hospitals. Since Alzentric does contain nicotine, it will need to be prescribed by a licensed pharmacist or a doctor. Much like a cough drop, Alzentric will be taken directly into the mouth, casually moving it from one side of the mouth to the other. Alzentric is not meant to be chewed, swallowed, or crushed. The lemon tang of the lozenge will provide the patient with a sweetness satisfaction before it fully dissolves. Now, our plan is to have the patient to take one lozenge per week before the patient is diagnosed with Alzheimer's, because our preventative method will no longer be effective once the tau tangles are tangled. Our package will include 24 lozenges per package, which will be 6 months worth of lozenges for the patient.
When determining the cost of production, we really only have to consider the cost of TBB because the other ingredients mentioned before are very inexpensive. The cost of TBB is 28 cents per milligram, which makes each lozenge $1.12. This means that the cost of production for each package is about $30, so we're setting our market price for $35. People interested may choose to purchase Alzentric through our website, where they can sign up to have a package delivered to their door every 6 months, or they can purchase it through a pharmacy or store for their retail price. While the price is a little bit high, we do believe it is worth it. The cost of care for Alzheimer's patients is thousands of dollars. We're giving them their cognitive and motor function for a little longer, which may be around a couple of months to a year. Anything counts for people with Alzheimer's because any extended time to live normally means that they can spend time with their families just a little bit longer while knowing who they are. By purchasing this medication, they would actually be spending less than the thousands of dollars of care they would be paying for if they had Alzheimer's during this time. Therefore, we believe Alzentric is an investment that is worth it. Since we're dealing with a highly addictive and potentially dangerous drug if abused, we have decided that only people 21 and older may purchase Alzentric. Now, you may be thinking that nicotine is fatal at a high dose, but we have arguments that our product is not fatal. According to the CDC, a fatal human dose of nicotine is 50 to 60 milligrams, which is equivalent to if a 70 kilogram or 155 pound person were to be exposed to 30 to 40 milligrams per meters cube of nicotine for 30 minutes, assuming 100% absorption. The total amount of nicotine in an Alzentric package is 96 milligrams. While this is over the fatal dose, there's no true efficient way to consume all of the lozenges within a timely manner for it to be fatal, even if you crush them all. Also, since we're selling these to people 21 and over, it would just be easier and cheaper to go buy cigarettes, which contain 10 to 12 milligrams of nicotine per cigarette. Therefore, we believe that cigarettes are much more a threat than Alzentric to drug abuse. Another preventative measure that we have put in place to make sure that we aren't making anyone overdose on nicotine is the weekly consumption. It takes nicotine 1 to 3 days to leave the bloodstream of a person when ingested. So we are providing plenty of time between lozenges to make sure that all the nicotine is flushed out of someone's body before they ingest more. Overall, Alzentric is safe to use. We truly believe that Alzentric will benefit the future of healthcare for people with a predisposition for Alzheimer's. Thank you for listening, and we hope you enjoyed our product, Alzentric.